Warning, if you have a faint heart or don't want any surgical details, this is not the video for you. Now, let me show you every layer I go through in knee replacement in order, and you will understand why it hurts so much. First is the skin, the epidermis and dermis. Then, the subcutaneous fat layer, which includes sensory nerves and small blood vessels. This is where numbness and a lot of early bleeding come from. Next is the deep fascia and peritoneum, which surround the extensor mechanism. I work around the quadriceps and patella tendon, and I cut through the medial retinaculum. Then I open the joint capsule sharply, which has two layers, the outer fibrous layer and the inner synovial membrane. The synovium is highly vascular and one of the biggest sources of swelling and inflammation after surgery. I then work through part of the infrapatellar fat pad that can bleed a lot. And I also remove meniscus and ACL. Now comes the bone work. I grab a saw and I go through the worn articular cartilage, periosteum, cortical bone, subchondral bone, and finally cancellous bone that can bleed a lot. Now I have to put implants on. Well, that's a nice way of saying it. I hammer them down with significant amount of force. Then the capsule, along with retinaculum and peritoneum, had to be repaired back, with barbed sutures with sharp needle going through your tissue multiple times. I will also burn any active bleeders along the way. More suture on subcutaneous fat and dermis, either glue or staples on the skin afterward. Painful just to hear about it? You're welcome.